Basically it was collective voices I wanted to hear about because I knew nothing whatsoever about it. Still don't know, I still need to go to a few more to be able to understand this a lot better.
I'm not sure yet because I don't really know about it. This is the first session, but once I get the gist of it, because after a few sessions of other organisations, conferences, you get to know what they're up to. So maybe in a few months I'll know more in detail.
I come to each meeting I attend with no preconceived notions. You just go with the flow and you see and hear what people are saying, and then you can interact with them.
What MHIP are doing is wholly revolutionary. I can't remember the last time there was a statutory group like MHIP that allows the power to be devolved.
What's so different about Collective Voice is that it fulfills the need for a more strategic look at engagement and the delivery services across the whole of the North West. And therefore, whereas groups can look to influence in localities or even through other mental health organisations across the country, I feel that really the message from the John Boynton report was that here was a need to drive up quality standards through this kind of body.
And it's good to see that other people have the same problems in their areas as you get here. There's a commonality about it.
We have been concerned as to understanding whether Collective Voice was about setting up local groups which would really duplicate and even be competitive with organisations like Cumbria Mental Health Group. And we know regionally there's a number of groups similar to ours who work in their very best to take forward the interests of local service users and carers with their NHS, PCTs and provider trusts.
Any new organisation, as with Collective Voice, will have its growing pains, and I'm mindful that we do have to have a lot of conversations as to the final shape of what Collective Voice looks like and where it's going to go.
I think it's very important that it should be anybody in the North West, and I don't think you should close your doors to anybody.
The people who come here should be the priority, but also it's nice to see people travel from Chester and Forestfield, Macclesfield have heard.
I think they have a great problem geographically, in that the region is one of the largest in the country, and it's not well populated, and there are serious differences between towns and country, and this is one of the, I think, the main themes that's emerged from the conference, the difficulty of administrating such a diverse area.
I just feel that the more people come together to make their voices heard, that the Trust will listen to us.
When I come to any Collective Voice event, colour and culture and that tapestry of people is missing, and it's missing in a huge way. Where are the BAMI groups? Where are the Black and Asian minorities within this whole programme? Why haven't we created something that brings them on board?
It's very satisfying meeting people a year later and seeing how they've progressed, and knowing that some of the issues they brought up then are still, but some have solved.
Meeting all these people who have got the same ideas in mind, trying to get equality and get the services rolled out that some people have got.
I've found this conference much more interactive. The reps have been given the opportunities to speak out more, and particularly on the panel discussions that we had off the cuff. That was very, very important, because it has to. This enables us to sharpen our thinking and ways that we could work in terms of some of our practice.
This one seems to be a lot more constructed, and I feel positive about the day, because it's no good keep going back and inventing the wheel again, which the first couple, that is all they were doing.
I think a big organisation would be a bit more helpful. I think some of the organisations, I think transport is a bit of a problem sometimes, and I think sometimes we're running over time, and know what groups we belong to as workshops. We need to work on that. But the presentations are really excellent. I find the presentations are really nice.
I think the location of Kendal is perfect, but I don't think the venue and the organisation's gone completely to plan, and that's why I'm tending to spend a lot of time outside with it being sunny anyway. But I felt quite claustrophobic, and again I've still managed to make a lot of new friends and contacts, but it's not other conferences I've been to with other organisations that they're a lot more spacey, there's a lot of light.
I suppose it was awkward not knowing the different types of people that were going to be there, particularly those with physical disabilities, and we had to be going upstairs, and it was a really cramped space. It was difficult to negotiate the space, so we had to relocate. And maybe that is something that we need to think about for the future.
You know, they are starting to listen to service users and carers, and I hope this continues.
We've had quite a noisy discussion today, and I think it has helped clarify the situation quite a bit, and we're understanding much more that it's about working in partnership with taking everybody forward in the northwest of England, that it is about supporting us in local groups, and there is knowledge that we need to gain and share and lobby with across the region so that we can all achieve what we want to do, which is better services in Barrow or in Crewe or in Birkenhead or in Bacup. And that's what it really is about in the end. We've got to support people at the grassroots, making a difference with their GPs and their local commissioning groups and local managers of provider trusts.